Imagine your kidneys failing and suddenly your life depends on a single question: will you find a matching donor in time? For millions of people worldwide, this is not just a medical issue, it's a fight for survival. Kidney transplant surgery is often the last hope. In this video, we'll walk you step by step through the process of kidney transplantation, from finding a donor to the surgery itself, and finally to life after recovery. By the end, you'll not only understand how it works, but also why this surgery is considered one of the most successful organ transplants in the world. Part 1. What is a kidney transplant? A kidney transplant is a surgical procedure where a diseased or non-functioning kidney is replaced with a healthy kidney from a donor. Unlike dialysis, which artificially cleans the blood multiple times a week, a transplant gives patients a new lease of life, allowing them to live almost normally again. But here's the key: humans can survive with just one kidney. That's why living donations are possible. One person's gift can literally save another's life. Part 2. Who needs a kidney transplant? Not everyone with kidney problems needs a transplant. Doctors usually recommend it when both kidneys are no longer able to filter waste properly, a condition known as end-stage renal disease. Causes of ESID include diabetes, the leading cause, high blood pressure, polycystic kidney disease, chronic infections, autoimmune diseases. When dialysis is no longer enough to keep the patient healthy, kidney transplant becomes the next step. Part 3. The donor process. Finding a match. Here comes the most emotional and complex part: finding a donor. There are two main donor types: one living donor, a family member, friend, or even a stranger who chooses to donate one of their kidneys. 2. Deceased donor, a kidney taken from someone who has passed away but previously agreed to donate their organs. Doctors run a series of tests to check compatibility: blood type matching, tissue matching, HLA typing, cross-match tests to prevent rejection. In 2025, new technologies like AI matching systems and genetic screening have made donor selection faster and more accurate than ever before. Part 4. Preparing for the surgery. Once a suitable donor is found, both the donor, if living, and the recipient undergo extensive medical evaluations. For the patient, full blood work and scans, heart and lung function tests, psychological assessment, nutrition and lifestyle counseling. For the donor, detailed health check to ensure they can live safely with one kidney. Mental health support. Since it's a life-changing decision before surgery, patients are usually placed on immunosuppressant medications to prepare their body to accept the new kidney. Part 5. The kidney transplant operation. Step by step. Now let's enter the operating room. 1. Anesthesia. The patient is given general anesthesia. 2. Incision. Instead of removing the old kidneys, surgeons usually leave them in place unless they're causing infection or high blood pressure. 3. Placing the donor kidney. The new kidney is placed in the lower abdomen, near the pelvis. 4. Connecting the blood vessels. Surgeons carefully attach the donor kidney's artery and vein to the patient's blood vessels. 5. Connecting the ureter. The ureter, the tube carrying urine, is connected to the bladder. 6. Testing the kidney. As soon as the blood starts flowing, the new kidney usually begins making urine right away. The operation typically lasts 3 to 4 hours. Part 6. Immediate recovery after surgery. After the surgery, patients are shifted to the intensive care unit. IQ for monitoring urine output. Doctors check if the new kidney starts working immediately. Medications. Patients are put on strong immunosuppressants to prevent rejection. Infection control. Since the immune system is suppressed, even small infection can be dangerous. Most patients stay in the hospital for about 7 to 10 days. Part 7. Life after a kidney transplant. Recovery is not just about healing from surgery, it's about adjusting to a new lifestyle. Key changes include daily medications. Lifelong immunosuppressants are necessary. Missing even a few doses can trigger rejection. Dietary adjustments. Patients must eat kidney-friendly foods, avoid too much salt, and maintain hydration. Regular checkups. Frequent blood tests are needed in the first few months, gradually reducing over time. Exercise and lifestyle. With a new kidney, patients can live a normal life, work, travel, even sports, as long as they follow medical advice. Part 8. Risks and complications. Like any major surgery, kidney transplant comes with risks. Rejection. The body may see the new kidney as a foreign object and attack it. Infections due to immunosuppressants. Side effects from medication such as diabetes, weight gain, or bone thinning. Surgical risks. Bleeding, clotting, or delayed kidney function. However, with modern medicine, success rates are high. In 2025, over 90% of kidney transplant patients survive at least 5 years post-surgery, and many live decades with their new kidney. Part 9. Emotional side of kidney transplant. Behind every kidney transplant, there's a story: a mother donating to her child, a stranger saving a life, a patient crying tears of relief after years of dialysis. It's not just a surgery, it's a story of human kindness, sacrifice, and second chances. Organ donation remains one of the most selfless acts a human can do. Kidney transplant surgery is not just about replacing an organ. It's about replacing despair with hope. Thanks to medical advancements, thousands of people every year are given a new chance at life. If you or someone you know is considering a kidney transplant, remember it's a journey that requires courage, discipline, and trust in modern medicine. But at the end of the road, there's life, energy, and freedom waiting. Don't forget, consider registering as an organ donor. You could save a life one day, and if you found this video helpful, make sure to subscribe to our channel for more episodes in our Life-Saving Surgeries Explained 2025 series.